It gives me great pleasure to be here today to launch the new online immunisation education programme and to do so to such a large and captive audience here and across the country. And thank you for the introduction, Mary, but just to clarify, while of course my priority is practice nursing, this resource is for all healthcare professionals. Just get the... I'm sorry, I just need to check. This is the one, isn't it? To move it. The green. Okay, great, lovely. This online new resource, it is on the HSE platform, and it is called the Immunisation Foundation Programme. If you have already are in HSE land, that's fine. If you're new to HSE land, you'll be asked to create an account to access it, and registration is free. So just a quick background, the origins of how this started. Back in 2008, the National Immunisation Office produced a training manual called Practical Guide to Immunisation. And that manual was designed to direct core immunisation education for healthcare professionals in the administration of our immunisation programmes. As I said, my role is to work with practice nurses primarily, and so there was a great need. Myself and my other professional development colleagues worked with the National Immunisations Office to be able to roll out immunisation training days based on the practical guide. And also the Centres of Nurse and Midwifery Education around the country, we worked closely with them to be able to deliver the programmes. So the first of those study days was delivered in 2008, and it was through in the CNME in Galway. And subsequently, that continued to be the pattern. We delivered these national, we stuck to the programme, let's say, and we delivered those days annually across the country. We always had the support of the National Immunisations Office and utilised local immunisations offices, local expertise to facilitate the sessions and with the CNMEs. So it was great because we used a national resource to be delivered locally. That they were, as I said, they continued annually. However, while they were very popular, we did adapt then as they went along. We tailored it so that the afternoon part of those study days would suffice as an update for people that had already attended the full days in advance. But however, there were gaps did appear, and we recognised that not all areas of the country were covered, because these happened predominantly where there was a PDC, as we call it, Professional Development Coordinator, in place, and not all areas in the country are covered. So the study days generally took place in those areas. So you had people having to travel long distances to attend the programmes. The programme sometimes got oversubscribed, particularly in 2016 when we introduced the new schedule. There was huge demand for these study days, and we had there was, I think, 7 study days delivered across the country, and we had over 1,000 attending these days, and there was other additional updates as well. The other difficulty was that access for training wasn't timely, so you could have the study day would happen annually, as I said, in one area or another. But if I had somebody coming in new to the practice, new to in immunisation programmes, they may have to wait. Then if they'd missed that one that year, they might have to wait then till the following year. So it wasn't timely enough for them. Also, there were different learning requirements. So while they were very well attended and there was great opportunities for interdisciplinary learning, we often found that at questions and answers time, you know, the vaccinators on the schools immunisation programme had different and very valid questions, but they may be, the vaccinators then on the primary childhood immunisation schedule would have more specific questions to their programme. So we recognise that. So what happened then was myself and my colleagues worked closely with the National Immunisations Office and collaborated, and Dr. Brenda Corcoran, who was in the National Immunisations Office at that time, recognised that this was something that we could work on. We wanted to create a timely core educational tool, and that would be pertinent for all healthcare professionals involved with the promotion or the administration of vaccination programmes. So we agreed on an e-learning programme method. We approached HSE Land. We discovered then that there was we actually needed some funding to do so. We were fortunate that the Office of the Nursing and Midwifery Service Directorate were agreed to fund it, recognised the importance and the value of doing such a programme. So we've secured funding. So work commenced on this in March 2018, and we had the core working group had representation from Public Health Department, community medical officers, the National Immunisations Office, of course, and myself and my PDC colleagues. So this is what it looks like when you enrol on the programme on the HSE Land. Let me see. So these are the 5 core topics that are covered within the programme. It should take you about an hour to do. Obviously, it can take you longer because there's lots of added extend my learning resources. So depending on where you're coming from and what your needs are, you can make it as long as you wish, and always can come back to it. So towards a national standard, as I said before, all healthcare professionals whose remit involves the promotion and delivery of any of the national immunisation programmes, we will be recommending that they access this online module. It's vital, and we've heard that repeated several times this morning, that as healthcare workers, they were trusted sources of vaccine advice. They were confident, and they were knowledgeable, and they were up to date. And that hopefully this programme will contribute to. There's no, it will be there, and it's timely. Foundation. That word is in the title, Immunisation Foundation, and as such, increasing professional confidence is critical to the success of immunisation programmes. We know that. If we're not confident about what we're doing, and if we have a parent or somebody in front of us who's, unsure, that translates. If we're not confident ourselves, we can't instill confidence or give that reassurance that that person is looking for before they make the decision. But as the title suggests, the programme covers the underpinning principles of how and why immunisation works. It is for, as I said, it's for all healthcare professionals, for new and experienced learners to immunisations, and it supports clear and consistent messages from all healthcare professionals. To add to that, and as I said, to move towards a national standard, the Centres of Nursing and Midwifery Education have, prior to this, already been providing a 4-hour face-to-face education programme for vaccinators on the schools immunisation programme, and also one for the seasonal influenza and peer vaccination programmes. And coming this autumn, you'll be glad to hear that they will be adding to their collection the primary childhood immunisation programme for vaccinators of that programme. I know we're running late, but I just wanted to make the following acknowledgements. To Dr. Brenda Corcoran, with whom we commenced this work. To Dr. Lucy Jessup for her continued commitment and work on the National Immunisation team. But I want to pay special thanks to Dr. Tom Barrett for his expert contribution and for his generosity in reviewing the content. I also would like to make special mention to Yvonne Morrissey for her accessibility and resourcefulness during the process. To Dr. Patrick Lacken from the Office of the Nursing and Midwifery Service Directorate, who funded the project. To Dr. Rosita Yulan Martin, Community Medical Officers Group. To Dr. Anya McNamara, who contributed from the Public Health Department. To Mike Stevens and Mark Jordan from Ariane Learning. They worked with us on the e-learning programme. They understood what we wanted and they were great to work with. I'd like to mention Mercer's Medical Centre. Within the programme there are videos of vaccine administration, and that's where the Mercer's Medical Centre facilitated us filming those immunisations. So thanks very much to the staff and the patients there that took part. To the National CNME, the Centre for Nursing and Midwifery Education Directors Group, and to the CNMEs across the country. And I know a lot of the CNMEs are supporting the links that are going on today, so thank you out there. And lastly, to my Professional Development Coordinator colleagues, Dr. Rita Lawler, she's here in the audience today, to Patricia McQuillan, I believe Patricia is joining us on the Kilkenny site, to Maria Courtney, who is in the Cork area, and to Kathy Taff, who is in the Sligo and Donegal area. Sincere thank you. Thanks for your attention.